lovely people, this is Margie on your screens. Now let's talk about clinical pelvic assessment. We want to find out if a woman's pelvis is adequate. Okay, so we use a variety of methods. The first one is general assessment. So during general assessment, you want to observe certain things, you want to ask certain questions to assess whether her pelvis is adequate. So you want to find out her ethnic origin, you want to find out her height, you want to find out her weight, you could even find out her waist size, her shoe size. All these give us a fair idea of how adequate her pelvis is. For instance, if a woman's height is less than 1.5 centimeters, it means that her pelvis is not adequate. If a woman is stunted or have a short height, it would affect her pelvis. When a woman has a very small shoe size, it affects her pelvis. Are you getting me? Yes. So you want to ask all these to help you in your assessment. Again, you want to use the observational scale. As a woman approaches, you want to find out, observe her gait. Is she limping? Okay, or do you see any muscle like atresia or muscle wasting of the legs? This could depict congenital hip deformity or anterior or poliomyelitis. Okay, all these give information about adequacy of the pelvis. Sometimes when you look at somebody having limping or having a bad gait, it could also mean they have had some trauma to their pelvis. You also want to ask them, have they been involved in any road traffic accident or sometimes home accident that has affected their pelvics. Okay, then we move on to the obstetric history. Now you want to ask the woman about her past pregnancies and delivery. Okay, so if she has had one previous delivery which ended in a healthy baby weighing at least 3 kg, then you know that her pelvis is adequate. However, if she had maybe a previous delivery which ended up in instrumental delivery, you have to question the adequacy of the pelvis. At least you have to assess further. Or she had a previous delivery but the baby's weight was small, so you cannot generalize and say that baby's weight is more, your pelvis is. What if it's not adequate and this time the baby's weight is bigger? Are you getting? So you use those observation information from her to help assess. Okay, aside that, we could do some external examination or assessment using what we call the pelvimetry. Even though pelvimetry is not really used, okay, because there are more advanced ways to do instead of doing the pelvimetry, but it's done with what we call the pelvic clipper. Okay, so that one we take the external, we don't go inside to do internal, but it's done externally. So we have the first diameter that you assess, it's called the interspinous diameter. In the interspinous diameter, the pelvic clipper is attached externally from the two sides. One on the left anterior superior iliac spine, the other one will be on the left anterior superior iliac spine. Okay, then you measure the diameter. Usually it's supposed to be 25.5. Okay, so if it's less than that, then there's a problem. It means the adequacy is not really guaranteed. We also take the intercostal diameter. In that diameter, you now push the pelvic caliper a little bit higher, where it's going to sit on the two iliac crest. So we take that diameter, and that diameter should be at least 28 centimeters. Again, if you take these two diameters and you take the difference should be 2.5. Okay, if it's less than that, then it tells you that if you don't get 2.5, it tells you that it may not be adequate. I hope you get it. Yes. Now after that one, you could also do what we call the external conjugate. In the external conjugate, now the pelvic clipper is attached whilst the woman is lying in the lateral side. When she lies in the lateral side, you want to position one of the clipper at the upper border of the symphysis pubis, then the other one that is at the back is going to the spine of the fifth lumbar vertebrae. Then we take that diameter as well. All these gives us a fair idea of how adequate the woman's pelvis is. Okay, then we are going to also assess the transverse diameter of the pelvis. This one we are not going to use the pelvimetry, but it's also going to be done an examination. Now you have a midwife washing hands, wearing gloves. Okay, then putting the hands in the vagina, trying to fit the fisted hand in between the woman's two ischial tuberosities. Okay, so if the pelvic is adequate, at least it should be able to admit 4 knuckles. So these are knuckles. So if I fit my hand like that, at least I don't know, at least this 4 knuckles should fit inside. When it fits inside, it tells us the transverse diameter is adequate. Yes. The next one we will use abdominal examination. Okay. In abdominal examination, we seek to assess what do you call how the head has been able to engage. So if the fetal head has been able to pass through the longest transverse diameter of the fetal head has been able to pass through the pelvic brim, then it means that it's adequate. So you want to assess the engagement at what from 36 to 37 and see whether the head has been able to engage. And usually if the head, the longest diameter or transverse diameter of the fetal head is able to pass through the pelvic brim, it is believed that the pelvic is adequate, except for cases where we have CPD in the outlets, which would now be seen as well having the ischial spine wall projecting inward and becoming very prominent and very sharp, or having what pubic arc which is very small. In that case, then we have a CPD of the outlet. In that case, even though engagement has taken place, it doesn't depict that the pelvis is adequate. But unless in that case, when it's able to engage, it means that it is adequate. Okay. In our next video, we will continue by talking about how we use vaginal examination to depict or to assess pelvic adequacy. Stay tuned. Bye.